Thank you so much to Dr. Anne Johnson for joining us for this event and for answering our online community's questions on managing fatigue. Before we start with the questions, I will hand over to Anne to introduce herself.
Thank you, Maya, and thank you to Target Ovarian Cancer for inviting me in to produce this webinar with them. I am a consultant occupational therapist and joint clinical lead for Bath Centre for Fatigue Services, which is a national service for people with complicated fatigue that impacts on their day-to-day life. We're based in Bath, but we take referrals from all over the country. When I'm not there, I'm also an associate professor at the University of the West of England for public involvement in learning and teaching, which is a very nice role involving people like people who will be watching this webinar in co-lecturing students and academics about their lived experiences of various health conditions. So it's lovely to be with you, and I'm looking forward to addressing some of your questions in this session.
Lovely. So before we start, if we could just talk a bit about the definition of fatigue.
So, defining fatigue. Well, we all understand fatigue and tiredness, and most people will relate to this in terms of having a busy day, looking after their children, looking after their relatives, going to work. The fatigue, however, that's experienced with something like ovarian cancer and any cancers can be very different. First of all, it might be not just physical, it can be cognitive fatigue, which some people describe as brain fog, where they can't think straight. But it might also be emotional fatigue. And most of our patients that come through Bath have a degree of physical, cognitive, and emotional fatigue. Now, the important thing here is that it is your experience, and don't let anybody tell you that it isn't. No one can necessarily see your fatigue, and it's something you're experiencing, and please don't feel guilty for that. The important thing here is, unlike maybe if you go to the gym or do a hard day's work, come home, maybe have a nice shower, good meal, good night's sleep. It isn't like that with cancer related fatigue. It can seem to our patients that what they've actually done during the day causes them some extreme fatigue that doesn't quite measure up with the amount of effort they've put into activities. And really importantly, is not alleviated by those usual means of getting rid of it, if you like, or managing it. And that can cause a lot of distress and a lot of concern and a lot of guilt when people can't do everything they need and want. Not really for themselves, more for other people than themselves. So, fatigue is a complex concept that can affect you physically, cognitively, and emotionally. All is not lost because there are things that we can talk about in this session to help you recognize those fatigue elements and also to put them in their place a little bit to make life a bit easier for you.
Lovely, thank you. So our next question is, what are the effects of fatigue?
So it's important to remember that you are all individuals. Um, as fatigue will affect you perhaps in slightly different ways. It is going to impact on all aspects of your day to day life. And when I talk about that, I mean across the 24-hour clock, not just your waking hours. Sleep can be disrupted in cancer experiences and may often be unrefreshing. It's therefore no surprise to think it's going to impact on what we call your self-care, which may be having a shower, washing your hair could be a big effort if you have fatigue. Also on other day-to-day activities in and around the home. And it's not until you can't do everything you need and want, like loading the dishwasher, putting the washing out, and having a shower and walking the dog, that people even notice the impact and effect of fatigue on their day to day lives. Obviously, it can also impact on your work if you're working, your leisure activities, socializing. You may feel you just haven't got any energy left. Classically, for working people, Most of their energies go into their work so that they can pay their bills and their mortgage, which is totally understandable. But their lives become a bit shrunken, and maybe the fun goes actually. I mean, having a cancer episode anyway, as you all know, will cause stress and anxiety. So you may not feel much like having much fun, but to be able to see a friend for a coffee and have a chat is important to lots of people. And the effects of having cancer-related fatigue, putting all your energies into work, may mean you can't prioritize seeing your friends. It's also going to impact on relationships, of course. Day-to-day relationships, your mood, the understanding of your relatives and friends. Do they really understand what it feels like to have the sort of fatigue that you may be experiencing? Probably not. They'll do their best, and I think some friends and family are a bit lost. Really, they're not quite sure what to say, so maybe they don't say anything or say the wrong thing. Obviously, this can impact on intimate relationships with your partner, and that can be really upsetting. And all of these things need to be taken into account when you are experiencing cancer related fatigue, because it disrupts your 24-hour clock. It really does. And a metaphor we use with our patients, which they find very helpful, is like that of the mobile phone battery. So, if you have a working mobile fit for purpose, what do you normally do? Well, you normally plug that in overnight whilst you're asleep. And that gets charged up to 100% the next morning. You wake up, you unplug, it's good to go. You know exactly what you can use it for. You might want to listen to a podcast. You may want to ring people in the car if you're working, and so on. By the end of the day, that perhaps is run down, and you'll repeat the process the following night. When you've had a cancer episode, often if you imagine yourself being like that mobile phone, you as a unit, mind, body, your physical, cognitive, and emotional energies, for some reason that we don't fully understand, do not get fully charged up overnight. Therefore, your charge is what we call less than optimal. Then you're trying to do everything perhaps you need and want and feel you have to do on a very limited charge. And that's when emotional distress can happen, because you're worried about letting yourself down, about letting other people down. And it's all very natural. Okay. But when I explain that to our patients, they say, that makes total sense. I want to do everything I need and to do, and that I'd really like to do. That was me before I became ill. And there is this tendency for our patients, quite naturally, to look over their shoulder and compare themselves to who they were before they became ill, and expect themselves to be able to perform in all of those aspects that we've just talked about: intimate relationships, at work, with their children, and so on, just as they did before they became ill. But they can't. And the key message here about the effects is, I may have mentioned this before, but I really don't want you to feel guilty. You didn't choose to become ill, and the impact of this fatigue, cancer-related fatigue, is very disruptive and very upsetting. But if you see it like that mobile phone metaphor, here in Bath, then we can begin to sort of unpick, well, what is that charge? What have you got? How do you use it now? How can we check what gives and takes to that battery that's not necessarily sleep, because we know that's not necessarily helpful. And then we start to tip into exploring what you can do to actually impact on that charge and monitor it as you go through.
So our next question is, what contributes to cancer-related fatigue?
Attending for appointments, when there's any mention of potential cancer, immediately you're going to feel emotionally fatigued. Okay. Go along to the GPs who says, "Oh, I'm not sure about this. I think we may need to send you somewhere to have a look at this and to investigate it further." Immediately, your energy levels are going to be impacted because you're going to be worrying. You may not tell other people. I've had patients who haven't told their family members, which causes additional anxiety and stress. And you're using that mental energy. The consultations, very tiring. Trying to listen and take in what's being said to you, trying to take in the results that are being delivered to you, especially if the outcome is not what you wanted, is all going to drain your energies and make you fatigued. The cancer itself might be why this fatigue that you've noticed, which is different. Maybe the very reason that you went to the GPs in the first place, for example, or sought some extra help or talk to your friends, and the journey starts. So we're not absolutely sure where it's coming from, and it is complex and involves multiple systems. The journey of going through the treatment and the treatments themselves are known to be contributing to fatigue. Chemotherapy, radiotherapy, surgery, all of those things will deplete your energy levels. Don't be surprised if the cognitive fatigue you experience actually makes you feel like you're losing the plot a bit, really. Patients come to me and they say, "But I can't get my words out. You know, I was in the car. I don't know where. I forgot where I was going. I forgot where I was driving." And they really are concerned about about their minds and about their brains not working properly. But these are all really common aspects of having cognitive fatigue. I think post-active treatment is a particularly tricky time. When I say post-active treatment, what I mean by that is folks who have had maybe some surgical chemotherapy and radiotherapy interventions, who maybe 3, 6 months, 12 months post those active treatments, as we call them, and are still experiencing this fatigue that's getting in the way, and they're thinking, "Well, I've tried, I've had a rest, I've done this, I've done that, I've eaten healthily, and I've still got it." But please do not be hard on yourself. Be self-compassionate, because we know that what we call sort of medium to late effects of cancer and its treatments are a real entity. And some of the first patients I saw, were a year on after completion of active treatments, and we're all different. So don't compare yourself either with people who seem to have sort of, oh, I don't know, dealt with it a bit sooner than perhaps yourself or whatever. It is known to endure for some folks.
So our next question is, what small changes can be made to help cope with fatigue? And we kind of also had a question around whether you should push through or you should kind of keep to a slower pace of life.
First off, I've mentioned it already, but I can't mention it enough. Drop the guilt, okay? Just put it to one side. As soon as you can do that, it doesn't mean to say that you like the situation you're in, but as soon as you can accept that you didn't ask to get it, it is about acceptance. And as I say, accepting is not rolling over and giving into it. But what can I do to sort of better organise my life, if you like, and manage it? So what does acceptance do? It actually liberates your mind, because what our patients do is they have limited energy. Remember the mobile phone battery metaphor. The energy anyway. And what you can fall into, here's a really easy small change, is rather than using, say you only got 50% charge of what you'd really like to do everything you need and want. So you're having already to prioritize and plan and pace yourself. And it might be the example I gave earlier where all the energy's got to go into work because you've got a big mortgage and you've got to pay your bills. Totally understandable. But if you can accept that it's there, then it will prevent you from wasting that valuable 50% charge on worrying and looking over your shoulder at the person you used to be, and trying to strive and using all of your mental energy and emotional energy to achieve, and physical energy to achieve who you used to be. Okay, because that's probably not possible at the moment for a variety of reasons that we just talked about, the treatments, etc. Similarly, what patients will do is, okay, so if they think, okay, I can't be that person, I am a different person for now, and this is my new normal, or whatever, if you can accept it, that's a good starting point. But just beware, because another small change you can make is not looking forwards too far and thinking, yes, but if I do this 3 months, 6 months time, what am I going to be like then? Am I going to do it? Or will I be able to go on holiday? Oh my goodness, you will implode and you will use a big amount of energy on trying to prophesize what the future is going to be. So, acceptance, try not to look back and compare yourself to who you used to be. That's a tricky one. And you will potentially go through a grieving process because people do feel a bit bereaved for losing who they used to be. And if you can acknowledge that, if that's a problem for you, just acknowledge it. And we have light bulb moments with our patients where they go, "Oh, I hadn't thought about it like that. You're absolutely right." And they can breathe. Okay. So don't look back. Don't compare. Don't look forwards because you'll use that valuable energy on fretting. Let's come back to where you're at now. Okay. The present. And think, okay, I've only got about 50%. And in terms of a sleep diary, you can estimate that for yourself on average. What on average have I got? Okay, there is a bit of looking back there, which sounds contradictory, as to who I used to be. Well, I think really I've got about 50%. Okay. For some people it might be less. So let's work with the 50%. Okay. Hopefully it won't always be like that, but just for now it is. So let's work with it. Let's be mindful. So what are the most important things to me on a day-to-day basis? Now, I'll give an easy example, just but only to illustrate the point. So if you're maybe a professional couple and the person here in that couple, one of the couple get ovarian cancer, both working, they both want to carry on working. Person who's had the cancer episode maybe wants to return to work, and their employer is supportive, and they're going back perhaps on a phased return to work. Okay, and you may have questions about work, and there are ways of working. Okay, and there are things like reasonable adjustments and stuff that you can ask for as well. So this couple want to prioritize their work. So the person on that 50% charge wants to be able to shower and dress, perhaps to go to work, and wants to go into the office. Maybe they work full time. They may prioritize their work, but they just can't manage full time at the moment. So they may negotiate with their employer that they're going to do 2 or 3 days a week. They're going to work from home for a while. What does that do? Well, that's a very small change, because it can prevent them having to get a train into London or whatever to do their job. It can prevent them having to use all their cognitive and physical energy on driving. You see, we're trying to maintain and be really smart about how we use that 50%. They may have a very short shower in the morning rather than, the old conditioner and everything else, or shave their legs and everything else, Every bit of energy you can sort of preserve for the things that are important to you are not lost, okay, across the 24-hour clock. Because as soon as you pop your legs over the side of the bed, and that will take energy. all through the day and all through the night as well, especially if you're not sleeping well. So you need to begin to prioritize what's important to you. That imaginary couple I've just talked about, it might be that the other person says, look, don't worry, I'll do all the food prep and meals and stuff, or we'll get some frozen stuff so it's easy for both of us because we're both working. We'll just plan perhaps to see friends on Friday evening at the end of the working week. We'll invite them here rather than going to their house. Because we'll have to drive to their place, and then we'll get more tired. That'll be more tiring for you, the person who has had the cancer episode. So you begin to plan, pace, prioritize, pushing through. Not great. But I do understand why people do it. See, what they do is with cancer related fatigue, you will have good days and bad days. And on those good days where you wake up and you think, oh, hang on a minute, I think I've got about 60% charge today or 70% charge. Right, that's it. We're going to go shopping. I'm going to go and see my friend. We're going to, have perhaps select some paint for the spare room, whatever. And what people will do is they will think, I might not be able to do this tomorrow. So they go a bit wild and they do what we call booming. Okay. And then maybe not the next day, but maybe the day after or a couple of days after, they will do what we call bust. Okay. So they boom and bust. So they've got this pattern of underactivity, overactivity, which is hugely disruptive. And can be quite demoralizing actually. So this is where the notion of pacing comes in, of prioritizing what it is you need to do, even on the good days. So that you don't overdo it, but you do enough that doesn't give you too much of a setback. Now, some of our patients say, well, I don't care about that because I'm going to a wedding on Saturday and I know I'm just going to go for it. And I said, well, look, at the end of the day, that's your choice. But if you know you're going to crash horribly by Monday, then you just need to accept it, that could potentially happen. It's about introducing what we would call restorative activities throughout your day, which make you feel like you've plugged yourself in. So remember you as that mobile phone battery, that you've plugged yourself in and that your charge has gone up a little bit during the day. That could be physically, cognitively, and or emotionally. Okay. So don't be scared to do that. It does take, a bit of assertion to sort of leave something, a party to go and have a sit down for half an hour or whatever. But you can get really smart about how you do that. Some people do keep a diary, and I mean on our outpatient fatigue and lifestyle management programs, we have something called an activity rest and sleep log. I've given links to Target Ovarian Cancer to the Southwest Cancer Alliance platform where the materials that I use for our patients appear. And I believe there is a page of an activity rest and sleep log on that website page. And essentially, there is something in the literature, in the research literature, that is, around having a good routine and how that can help you with support your pacing. So here's a very basic thing that you can do. Small change is having a regular time of going to bed at a regular time of getting up, even at the weekends. We know you can sort of train your brain a bit. It's a little bit like training kids to sleep through the night. If you can train your brain that, oh, okay, it's time now to get up or it's time now to go to bed. Yeah, there is some evidence out there that says this is quite helpful for people who have limited energy. The small changes around that is having good sleep hygiene. There's lots of stuff out there on, if you Google sleep hygiene, it's not about having a wash before you go to bed. It is actually about adopting practices which are really easy, which will tell your brain, oh, okay, she's getting ready for bed now because she's having a nice warm shower. She's putting on some nice pajamas. She's having a hot chocolate. That's what you like. They just put a bit of lavender sort of oil there in the room or whatever. There's lots and lots of tips for good sleep hygiene. Having a room that's not cluttered, having a room that's not too hot, too cold, a mattress that's not too hot, too firm, too soft. White light will switch on your brain. So a little red bulb to help you see your way safely across the landing or to the loo is good because it won't trick your brain, won't switch your brain on. So if we think about that, you can use white light to activate your brain. And that's really, really helpful because even if it's only, it might be terrible outside, it might be snowing, raining, whatever. But if you get out of bed and you open the curtains and you just get natural light, and it's getting lighter now in the mornings, natural light onto you, that will activate your brain and switch it on. Some of our patients will grab a cup of tea, open the back door with their pajamas on and their coats, and just enjoy a cup of tea by the back door. Just do it. Others will use those clocks which have natural light, which emit. You can use them as an alarm. And they gradually get brighter in your bedroom. If maybe that's an idea, that's a very, very small change. Always question, okay, if I don't do the washing today, if I don't clean the kitchen floors today, will the world stop turning? Probably not. Okay. But it's so weird, the things that we impose on ourselves, really. I've got to do this. I've got to do that. I should do that. I must. I want you to catch those phrases, which are honestly, they are heart sync phrases. They are the should, must, have to, got to. Okay. If you find yourself speaking in that way, I really want you to stop. Just slow down. Take 5 breaths. No one need know you're doing it. Okay. And question yourself. Really? Do I have to? Okay. Because chances are they don't. Another couple of tips. Does it all have to be done? Now, this is about smart goal planning. Yeah. Do I have to do all of the dark wash today? Do I have to do all the delicates? Do I have to do the whites? These are just examples. You can apply them to anything. You can apply to gardening. You can apply them to preparing school uniform for the following week, whatever. Okay. Can I just do the dark wash today? Yeah, probably. Okay. It does require a bit of planning. And this is where a diary could be useful for you, or even a calendar, whatever works for you. What I say to our patients is if you find a diary and making lists too onerous, don't use it. If you find it helpful, that's great. So if you need to make a list, I'd say just to put your top 3 for the day. Okay. Because we all need to achieve something. And if you haven't ticked off something off your list at the end of the day, it's gonna I'm sure it's gonna make you feel really fed up, and then you're gonna beat yourself up, and then you're gonna get guilty, and then you're gonna think of expectations. So prioritize, plan, pace. Okay, all of those things. Sure, there are going to be things that you can't do at the moment, but you can if you do less of the mundane, if you like, because we all need some fun. We all need some pleasure. We all need to do things that make us feel human and that we've got some quality of life. And I would also encourage you to do something that makes you smile, that makes you feel close to your partner, and so on. The thing is getting the balance right for you, and we're all different, okay? And a personalized approach is needed. And as an ambassador of the Personalised Care Institute, a great institution, good to have a look at their website. We're all different, and you will all go at different paces. And it is about doing stuff so that you feel you're getting something out of every day without overdoing it at this point. It may not and hopefully won't always be the same, but just for now, be mindful. Remember the 3 Ps: prioritize, plan, and pace. And small list, tick 1 or 2 things off, don't make it onerous. And don't worry if you don't achieve everything. It might be that the thing you put on the list you hadn't broken up enough into more manageable chunks.
Lovely, thank you. So our next question is, can changes to diet help improve fatigue?
Yeah, good question. I think the short answer is yes. For our patients, what we find is that actually having healthy snacks to graze on throughout the day that they can, are portable, they can take around with them. But a lot of our fatigue patients find that that's quite helpful. So rather than perhaps having a big breakfast and a big lunch and then a big dinner, is to have maybe smaller and some people who are going through the experiences that you will be going through or have been through just can't face a big meal anyway in the evenings or whatever. So to have a smaller meal, but to have the healthy snacks throughout the day can, according to some of our patients, help to keep their energy levels up. Okay, and you will determine what they are for yourself, as I said. Um, Also keeping hydrated, plenty of water is good. Yeah, again, if you have pre-existing conditions where that can be an issue, you need to be balancing that advice with healthy eating as well. The British Dietetic Association has lots of information on their website, and this is where the dietitians obviously sit, who are some of whom are experts, specialist practitioners in advice around cancer and diet. So do have a look at those. Macmillan Cancer Support, their website may have things that you might want to access as well around diet. And your own treatment teams, your own oncology teams, gynae teams, etc., may well have information that is particularly pertinent for you because they will know you individually. So I guess eating at regular times as well, some general information there.
Great, thank you. So our next question is exercise beneficial for managing fatigue, and kind of what type of exercise can help with fatigue?
First of all, I'm going to question the notion of exercise. Okay, that is because becoming physically active may just be that. It may be physical activity of some sort that's not traditionally classified as exercise. I think the word exercise can be very off-putting for some patients. They, oh no, I've got to go to a gym. That means I've got to get on the treadmill or the cross trainer or whatever. And it needn't mean that at all. It can mean walking around the park, of course. So first of all, what am I getting at? I'm getting at motivation, really. If the idea of getting in a gym or on a treadmill just does not appeal to you at all, chances are you're not going to do it. All right. Whatever the evidence is around getting active, I'll call it. Okay. So there's more ways than one. So think about what for you would appeal. All right. It could be gardening, for example. All of these things are set to sort of what make you physically keep you going, use it or lose it if you like. Keep a range of movement going. You do get happy hormones released when you're engaging in physical activity. So yes, it can help. It can help you to manage your fatigue. And for some cancer types, there is some research to say it can actually help reduce cancer fatigue. Um, so, it's worth thinking about. What I would say to you, not knowing you all individually that are going to be watching this, do take advice from your treatment team. If you have particular abdominal discomfort or anything similar to that, that has been brought about or is associated with the treatments you're having, etc. Do take care and take some advice from your medical team around what sorts of perhaps physical activity you should be doing. But generally speaking, yes, it's good to become physically active. But there's more ways than doing it than one. And I would encourage you to think about what it is you like, what you enjoy, and what you can manage. And again, to if you're a bit nervous about re-engaging, to start in a gentle way. And I believe that the team here at Target Ovarian Cancer are going to integrate some yoga experience here in the webinar. So really, that and the stuff I'm saying is really thinking about your mind, your motivations, your emotions, as well as the physical components. So by all means, explore it. It's fantastic if you want to get back to some sort of exercise or physical activity. And just have a look around though for the advice that's there, and use your medical team if you're at all nervous about anything.
Thank you. And as Anne mentioned there, we do run our weekly yoga and relaxation class every Wednesday, 2 p.m. till 3 p.m. on Zoom. And we are going to hear from Jill, who is a regular attendee of our class, to share her experience and what she finds beneficial about attending each week.
So I was diagnosed in 2017 with mucinous ovarian cancer, which was a huge shock, made even worse by the fact that my mum passed away probably about 4 months after my own diagnosis, also with ovarian cancer. So it was a really dark time. I was dealing with the bereavement of my mum. I was dealing with the shock of my own diagnosis. I just felt scared, lonely, the changes to my body, the fatigue, which I really hadn't expected. So it was just an awful time. And at the same time, I was also trying to put on a good face for my friends and family. So I felt extremely isolated. And then my Macmillan nurse told me about target ovarian cancer. And when I went onto the website, I found out about the yoga classes. And that was honestly one of the best things I've ever done for myself. Um, I love the fact that I don't have to leave the house. I don't have to go into some drafty hall and stand with a load of people who are amazing at yoga, because I would find that very demoralizing. And instead, I can take the classes in the comfort of my own home. I've got my own safe space. I can go at my own pace. I've usually got a cat walking on my chest or walking past the camera. So it feels a very relaxed, very just non-pressured thing for me to do. Claire, our teacher, is amazing. She's obviously aware of what our bodies have been through, and everything that we do in the class is tailored to help our bodies to heal. She explains everything that we do and what it's going to be good for. She always encourages us to listen to our own bodies, go at our own pace. She modifies any exercises that we need, so you can work from the floor, you can work from a chair. Last year, I was also diagnosed with skin cancer, so I had quite radical surgery on my arm and my lymph nodes, which made it really difficult for me to use my arm. And she was able to modify everything I needed to, so I was still able to continue with the class, which that was a really good feeling for me. It felt very kind of enabling. The other part of the class is the relaxation, which is wonderful. And we learn about breathing techniques, the relaxation, the mindfulness. All these things I've then been able to use at night when I'm awake and I can't sleep and my mind's going crazy. So it's just a wonderful class. I honestly think it's the most empowering thing I've ever done for myself, because by doing the class, I know that I'm healing my mind and I'm healing my body. And I really thoroughly recommend that anybody tries it. And don't forget to bring your cat.
Thank you. So our next question is how to manage fatigue when sleeping at night can be difficult due to other symptoms and side effects.
For some of our patients, there is that temptation to think, oh, the night time was dreadful, so I'm going to catch up during the day. And that can actually be a bit of a slippery slope, understandable as it is. But if you start to have particularly lengthy periods of time during the day, a couple of hours more in the day, what can happen is you can begin to change your sleep-wake cycle. And this can unwittingly mean that you change your sleeping times to daytime and then you are awake more at night. What I would say to you, in my experience, quite a lot of the cancer patients that come through Bath Centre for Fatigue Services are able to manage a sort of power nap, if you like, without it impacting too much on their nighttime sleep. And I think that's the message, really. If you find you can have, say, half an hour, maybe an hour max, I would say, really, to try, and then you're still sleeping okay at night and you're getting some refreshing sleep on waking, you feel refreshed, then maybe that's okay. And maybe at a certain point in the day, and classically, people will dip sort of after lunch in the afternoons because they've had something to eat and, they've maybe done things in the morning, etc. So a sort of powery nap, I think, would be okay. And it seems to be okay with lots of our cancer patients. Alternatively, you could try and find something that you find is restorative, that's not sleep. Now, earlier on in the recording, I talked about you being like a mobile phone. Your energy is you as a whole person. You are like a mobile phone that usually, when it's working well, gets charged up right to the top when you plug it in. And with cancer and associated treatments, that doesn't happen. So you may be on this half charge. So finding activities during the day, not necessarily sleep, that make you feel like you've plugged yourself in. And remember, this fatigue is complex. It's physical and or emotional and or mental, cognitive fatigue. So finding activities that make you feel like you've refreshed all or one of those sort of aspects of energy is very powerful, actually. So, I mean, for me, that would be to recharge me, particularly physically, I suppose, well, and emotionally. Having a nice cup of tea, maybe, naughtily, a slice of cake, sitting quietly somewhere, maybe, with my feet up for 15 minutes. I think that would be quite refreshing for me. For other people, it may be just popping on, a jacket and getting the umbrella out and just walking around the block in the fresh air and just taking in some fresh air. For other people, it may be reading, although I wanted to say to you earlier, actually, that reading, don't be hard on yourself if you find reading really, really cognitively exhausting, or watching a TV show and trying to follow a series, that sort of thing, or a film, because it may be you can't join together the dots and follow the plot because cognitive fatigue is more of an issue than physical. All right, we're all different. We're all made up differently, and this fatigue is a menace and will disrupt you in different ways. So some people may find reading restorative, others may find it very exhausting. So again, it is about giving yourself permission to find something that makes you feel like you've plugged yourself in during the day to restore your mobile phone battery that is you. And then we know that chances are you get to the end of the day feeling in a better state than you would if you'd have used up all your energy and done what we call boom and then busting. Okay, so some very practical bits there about how to manage it during the day.
Great, thank you. So our next question is how to support someone with fatigue.
Quite often the partner or family are not quite sure what to say or do. They don't want to say the wrong thing. They do want to say the right thing, but they may not know what it is. My best advice is to give the person going through the episode time to talk to you about how they feel about things, how it's impacting on their lives. Lots of our patients are fiercely independent, and we need to be mindful of that. The worst thing, really, it's really strange, this, but what you don't want to do is sort of take away their independence, actually, because I think there's a desire for partners and family and friends to help folks. But we mustn't disempower by doing that. Okay. And I'm speaking generally because you're all different and I haven't met you, and you will all have different needs and aspirations. But listening, trying to offer practical help to the person. Ask them what sort of support they need. What would you like me to do, love? You know, do you want me to help you with this? Would that be helpful? Can I get you that? Do you want to do that yourself? I don't want to stop you if you feel you can. And those authentic conversations are the best and most valuable that you can have. Okay. Being there, maybe at consultations, but ask them if they want you to go with them. Ask them if they want you to take notes, or jot down any questions or responses. That's fantastic, because then they can just concentrate on try to concentrate on what's being said, and they've got a second pair of eyes and ears, with you there. Do, between all of you, the two of you, family, do things that you want to do together that are nice to do. Have some fun if you can. I know it's easier said than done, but take time to relax together as well. Find ways around things. Support them by doing a bit of something, even if when you used to go for a picnic, it would be like all afternoon. Go for an hour. Go for an hour. Offer to drive them places if they can't drive or they're advised not to drive for a while. Things to make life easier, to make this smoother. It may be that they may need some or seek some professional counselling. It may be that you both may need that, because we don't forget the other person, the other people. The number of times that, patients have said to me, if I had more energy, I'd like to play with my kids more. I can't be the dad. I can't be the mum I want to be, whichever form of cancer they've had. So, it may be that you also need some emotional support, and that's okay. Some people may want some couples counselling, for example, if they're going through difficult periods of time. But I think my best advice is ask them. Ask the person what sort of support they need. And also, another key thing is, because they need it now, don't assume they still want it in 2 weeks' time or a month's time, because they may have moved through it by then and say, oh, hang on a minute. Look, I know you did that for me before, but actually, I want to do that now myself. Don't assume that they can't do it, but don't assume that they can and want to either. So it's a tricky one, but do also take care of yourself. And do some of the stuff together, do some of the physical activity together, maybe do some of the relaxation together, because then you'll get more of an understanding, of what it is. Do look at the materials they've got and what's being shared. Watch this with them. Look at other stuff with them. Look at diaries with them, think of things that you can do together. And that way, hopefully you can get through this in a more constructive and more supportive way for both of you, because, for all of you, there's the whole family and friends around you, and the person will all need support.
Thank you. So moving on to our final question, is where to access support, and then kind of including how to speak to your GP about fatigue, to explain it's more than feeling tired, and what help is available for long-term fatigue as well.
The first thing I'd say to you is I really, really would like you to think about what you mean by the word support. So I would really, really, really encourage you to define what it is. Now, within that, it might be information like this today. It might be where do I get hold of an activity diary, for example? And we've said that you may be able to get one of those online or from there's a Southwest Cancer Alliance group. I did their fatigue platform, and there's a diary template in there. There may be things to do with things like work-related benefits for those who are working, the employment support allowance. So this is where Citizens Advice Bureau and Citizens Advice websites can be quite useful. If you can make an appointment at Citizens Advice around benefits, not just work-related ones, but others, that can be quite helpful. If you don't do IT stuff, maybe local libraries, or maybe find a relative or a friend that could do that for you and with you. But on a more basic level, speaking to your GP about fatigue, no, I used to do a sort of UK-wide study day for supporters of Leukemia UK. And I've had people come up to me saying, well, my GP has told me that I've had my cancer treatments now, and it doesn't really exist anyway. This fatigue, I should be getting on with it, really. I should be grateful that I've sort of got through the treatments and moving on. And they said, what do I do? And I said, well, you just tell them. But the other thing is that Macmillan Cancer Support about 5 years ago now published a massive report called The Consequences of Cancer and Treatments. It is recognised in the research literature. And you can say this, you can say, well, it is recognised. And this is the only time I'm making a reference for you. In the research literature, that about 90+% of anybody who's had a cancer episode will have significant fatigue at some point in their cancer experience. So that's well documented. So I'd like some help, please. Okay. You could also say, I know that from what's out there at the moment, word on the street, is we're not just talking about physical fatigue, we're talking about cognitive and emotional fatigue. You see, that actually will say to some GPs, oh, I think this person's done a little bit of research on this, and I may need help. I may need help with possibly some sleep medications, possibly some pain medications, possibly with accessing counselling via the GP surgery for anxiety related to this or whatever. You're quite within your rights to mention all of that to the GP and say, I am aware that it might go away, this cancer-related fatigue, because it might, okay? Because we don't quite know the mechanisms and what causes it. It may go away, but it might rumble on for you. And if you're one of the unlucky ones where it does rumble on, then all of these symptom control things, and that's where listing your symptoms, taking that into the GP, telling them that you know that cancer-related fatigue exists and that these are your symptoms, and are there any things that they've got in their GP surgery or they can signpost you to that can help from a mind and body perspective, all right? Not just them giving you a prescription. Can they help you to access any of that? That's great. In the longer term, well, if it hangs around, there are cancer charity websites which will have managing fatigue that I've been involved with, and there are resources there like which go more into pacing, planning, prioritizing and stuff. You can actually self-refer to Bath Centre for Fatigue Services for cancer-related fatigue. And for some people where fatigue is endured and it gets in the way significantly on a day-to-day basis, it may be worth you looking at our website, which target ovarian cancer can give you the link to. It won't be for everybody, but we run outpatient-based fatigue and lifestyle management programs which generally are 6-week programs, and we can run those virtually. So there are lots of resources out there, and some of you will need much more specific and, pardon the pun, but targeted ones, and others of you will need just a light touch and may not need anything else. But don't be afraid to ask for support and to contact Citizens Advice and have a look at DWP website, Department of Work and Pensions website, around working with cancer, etc. Because something that myself and my team spend quite a lot of time doing is writing letters of support for reasonable adjustments at work. And your GP could potentially do that as well. I would like some reasonable adjustments at work around regular breaks or blended working, working from home, working in the office part of the week, having my desk closer to the loos if you find you need to use the loo a lot, access to work if you feel that you need a different chair or whatever, to manage some lower back or pelvic pain or whatever. All of those things you're entitled to talk about with your workplace people. And if you're offered, general rule of thumb, if you're offered an occupational health appointment, it may be worth taking that, because they're on your side in terms of knowing about your illness, and they can also support you with reasonable adjustments at work. And we work very closely as occupational therapists with occupational health providers. So yeah, there are lots of things, and it's a bit of a minefield finding your way through them at times. But do talk to people, ask other people that you know who've been through similar episodes, and I'm sure you'll find something there that can help you. But most important is define what support is for you.
Lovely, thank you. So that brings us to the end of our questions today. Thank you so much, Anne, for joining us and for such an interesting session. I'm sure our community will find it really useful. If you do have any questions, concerns, or would like to have a chat, our support line is open 9 a.m. till 5 p.m. Monday to Friday. Please call us on our free phone number 0808 802 6000 to speak to one of our specialist nurses. But thank you so much to Anne and for you for watching today, and we hope to see you at another event again soon.